Tomorrow is World AIDS Day, and a new report from the Centers for Disease Control and Prevention says 1.2 million Americans are now living with HIV. Testing and treatment are helping patients to live longer, healthier lives, but there is still much work to be done. Joining us from the CDC in Atlanta this morning is Dr. Kevin Fenton. He's director of the National Center for HIV/AIDS. Sir, good to have you with us this morning.
Good morning. Thank you for having me.
And now we know on the positive side there have been significant improvements. 28% of those living with HIV now have it under control with medication, although I know you and so many other folks would like to see those numbers rise. So what more needs to be done?
So you're absolutely right. We now have very, very powerful tools to really have a tremendous benefit on the lives of people living with HIV, as well as to help them prevent transmitting HIV to others. So today, what we need to focus on is how do we get more people tested, more people linked to effective care, and more people started on these life-saving treatments, which can be a key tool to ending the epidemic in the United States.
You mentioned testing and access to care. What are the biggest barriers to those two?
You know, 30 years into this epidemic, we know that so many people are still afraid of getting an HIV test, and there's no need for that fear. The diagnosis is very easy, it's simple, and it's cheap, and there are now life-saving, effective treatments which are available for HIV. So we need to address our fears, we need to address our stigma against HIV, we need to get more people into care and treatment.
There's an article recently in the New York Times talking about new hope for even an AIDS cure. How realistic is that?
Well, you know, a cure is still a long way off, and what we need to do today is to ensure that we are using the tools that we have available to us. That includes HIV testing, effective treatment and care, using condoms, and helping people to reduce their risk behaviors. The better we can do that management today is the better we'll be able to really leverage the cure when it becomes available.
One of the biggest barriers, and you touched on it a little bit, has been the stigma that was associated with AIDS, with HIV. How much of that barrier still exists? There have been really significant inroads made there.
That's correct. You know, 30 years into this epidemic, I think we've made a tremendous advance, both in terms of improved knowledge and awareness on HIV. People are now much more aware about and able to talk about HIV, but we need to do a better job. And there's some populations which are severely affected. For example, Black, gay, and bisexual men in the United States. And that's why CDC is focusing, or campaigns now, we've launched a new campaign focusing on Black gay men to promote awareness and better testing and linkage to care.
So then give me an idea. You've launched this new campaign. We've looked at some of the numbers. 5-10 years out, where do you expect us to be?
Well, my vision is that in 5 or 10 years, we will have managed this epidemic. You know, too many people are becoming HIV infected every year. About 50,000 Americans are becoming infected. That's far too much for our country, and we can do a better job. And part of that is ensuring that we're all aware of our HIV status and talking about HIV, that our physicians are offering the test to more people, and more people are availing themselves of the life-saving treatments, which can really help to bring an end to the epidemic.
Because as we know, it is so important to point out, this is not a death sentence. So many people living and managing it. Dr. Kevin Fenton, appreciate your time this morning. Thank you.
Thank you.